2021 ordinance adopted by the LA City Council approved by then Mayor Eric Garcetti required COVID-19 vaccinations all for.
What is mental health? Mental health is a state of mental well-being that enables people to cope with the stress of life, realize their abilities, learn well and work well, and contribute to their community. It is an integral component of health and well-being that underpins our individual and collective abilities to make decisions and build relationships and shape the world we live in. Mental health is a basic human right and is crucial to personal, community, and socio-economic development. Mental health is more than the absence of mental disorders. It exists on a complex continuum which is experienced differently from one person to the next, with varying degrees of difficulty and distress and potentially very different social and clinical outcomes. Mental health conditions include mental disorders and psychosocial disabilities, as well as other mental states associated with significant distress, impairment in functioning, or risk of self-harm. People with mental health conditions are more likely to experience lower levels of mental well-being, but this is not always or necessarily the case.
When many countries, including Malaysia, are still struggling to contain the COVID-19 epidemic, the mental health of the people also needs to be focused on.
46-year-old Asun, not his real name, has been a hawker all his life in the northern state of Penang. He lost his store earlier this year after he couldn't afford the rent, with business badly hit by the protracted lockdown. He contemplated ending his own life because the misery was too painful to bear. Local Member of Parliament Stephen Sim described Asun's condition after visiting his home.
When I first entered his house, Asun was surprised. Asun looked clearly he was in a distress. He was very sad. He told me he has given up and wanted to take his own life. In fact, he told me that he has informed his neighbor that he can use his motorbike when he's gone.
But Asun's eyes lit up when the conversation turned to the best dishes he used to serve.
And I can see the enthusiasm in his eyes as he began to discuss with me his menu. But I say, yeah, why not? Let's go out, let's get a store, buy the ingredients, and let's do it.
After his plight was highlighted in social media, business at Asun's store has shot up, with orders pouring in across Penang, and exhausted Asun felt so alive and happy.
好啊，今日生意唔錯，做都唔錯，係最開心嘅一日啦。
Asun's story has warmed the hearts of many and driven others to help those in need.
Now, indeed, this pandemic has hit everyone hard, especially from the lower income groups. The lockdown and the subsequent isolation are worst enemies for depression that saw over 400 people ended their lives tragically in the first 5 months of this year.
On average, 4 suicide cases reported each day, with the densely populated Selangor recorded the highest number. The situation has prompted the Health Ministry to task the society to watch out for symptoms of depression, such as any change in behaviours among friends, colleagues and relatives.
The COVID-19 pandemic had a significant and lasting impact on the mental health of people worldwide. Social isolation, fear of the virus, economic instability, and grief over loss all contribute to a surge in anxiety, depression, and post-traumatic stress disorder (PTSD). The World Health Organization (WHO) estimates a 25% increase in the prevalence of the conditions during the pandemic peak. Children and adolescents were particularly vulnerable, facing disruptions to their education and social lives, which could increase the risk of family stress and abuse. Women also face increased stress due to the burdens of caregiving and potential exposure to the domestic violence. But the needs for mental health service rose. These services were often disrupted, leaving many without access to the support they need.
COVID-19 has had a profound impact on society in several key areas. Health and well-being. The pandemic has disproportionately affected vulnerable groups like the elderly, disabled, and those living in poverty. Many lost loved ones to the virus. Healthcare system were overwhelmed, leading to shortage of critical supplies and overworked staff. Lockdown and social distancing measures took a toll on mental health, especially for those with existing issues. Economy and employment business like restaurant, shop and tourism were devastated by lockdown, leading to mass unemployment. The economic impact is largest since World War II, with countries facing huge financial burdens, poverty and food insecurity increase, especially for those relying on school meal. Education. School closure disrupted learning, exacerbating inequalities in education. The shift to online learning highlighted digital divide, with many students lacking access to internet and devices. The consequences of lost learning will be felt for years, as fully recovering lost education is unfeasible. Social cohesion, lockdown isolated people from family and friends, straining social connections. Trust in governance was shaken by the uneven response in many countries. Exciting inequalities were exposed and exacerbated, creating new vulnerabilities in society. In summary, COVID-19 has had far-reaching social impact that will continue to be felt for years to come. It has been a catalyst for change, exposing critical needs and inequalities that must be addressed to build a more resilient and equitable society in long term.
Currently, the COVID-19 pandemic has a major impact on the economy, and Malaysia is not an exception. Because of the necessary solution to its gradual and uncertainty, the pandemic has been an obstacle and all one was in the term of mental health. As a result, there is now a greater need for mental health treatment and assistance. Malaysia's economy has been upheaval in a number of areas such as small enterprise, tourism and manufacturing. Although government initiatives like stimulus packaging have been put in place to lessen the economic impact, recovery is a difficult process that involves taking care of mental health issues as well as public health issues.
This is how to overcome COVID-19 diseases. The first one is vaccination. Mass vaccination campaigns are crucial to achieving herd immunity and preventing the spread of COVID-19. Vaccines train the immune system to recognize and fight the virus, reducing the severity of illness and preventing hospitalization and deaths. The second one is public health measures. Practice like wearing masks, maintaining physical distance, practicing good hand hygiene, and avoiding large gatherings help to slow the spread of the virus. These measures are particularly important in areas with high transmission rates or where vaccination rates are low. The third one is testing and contact tracing. Identifying and isolating cases quickly through widespread testing and contact tracing helps break the chain of transmission. Rapid tests, PCR tests, and other diagnostics are used to detect infection, while contact tracing identifies notified individuals who may have been exposed. The next is international cooperation. COVID-19 knows no border, so international collaboration is essential for controlling its spread. This includes sharing information, resources, and best practices, as well as coordinating vaccine distribution efforts to ensure equitable access worldwide. The last one is research and monitoring. Ongoing research into the virus, its variant, of potential treatments is critical for staying ahead of the pandemic. Surveillance systems monitor virus activity and track emerging variants to inform public health responses and vaccine development efforts. Combining these strategies with effective communication and community engagement is key to successfully combating COVID-19 and mitigating its impact on public health and society.